I'm joined in the studio by France 24's Vedika Bahl. Today's topic is Mpox, the virus currently with an outbreak across several African countries that's triggered the WHO's highest alert. But that's not just the only thing that's spreading, as there's also been a spike in online disinformation. Vedika, can you clear up these false claims for us?
Yes, indeed, Yinka, I can. One of the top fake news stories surging online at the moment is the claim that Mpox symptoms are linked to the side effects of the Covid-19 vaccine. And this all links back to claims involving a video of a German respiratory doctor, Dr. Wolfgang Wodarg, who said in an interview that he believes the symptoms of Mpox are the same as shingles, which he says is a Covid-19 vaccine side effect. In the same interview, he went on to say that he accused the pharmaceutical industry of creating Mpox by scaring people in order to try and get business. So let's take a listen to that viral video that is that is circulating all over the internet. Now, transparency for our viewers, this is a dubbed in English extract of the interview. It's not in the originally recorded German language, but this is the video that people are sharing online with these false claims. And I saw this video dubbed in a slew of different languages, from Japanese to French to Spanish as well. But this is the English extract of that interview of the doctor.
If regional blisters occur, they're linked to severe pain in monkeypox. For heaven's sake, this is the typical clinical picture for shingles.
Now, there are several things, in fact, to unpack here. And the first one being that, in fact, this interview that we saw there, this is, in fact, 2 years old. It was filmed back in 2022 when Dr. Wodarg did an interview with Austrian broadcaster AUF1. It is a far-right Austrian channel that's actually known for spreading misinformation and promoting conspiracy theories. Secondly, there's no evidence in the full 45-minute interview that he did with them where he provided evidence in order to back up his claims. If we also have a little bit more background on the doctor as well, Dr. Wodarg, he's actually known for his denial, if you will, of COVID-19. He has previously drawn some pretty strong criticism for comments that he's made about the COVID-19 vaccines being responsible for infertility in women. He's also gone on to say that the COVID-19 virus was created for hype, and he has been fact-checked several times over the last few years for his claims surrounding COVID. But regardless of the person making those claims and the channel that it was filmed on and the fact that it is old, the two viruses that we're talking about in these claims, Mpox and shingles, have no scientific link whatsoever. They are from two very, very different virus families. Mpox is part of the pox virus family, whereas shingles is a type of herpes, and they do have different shapes and structures as well that we can see there. Now, they both do cause lesions on the skin, that is correct. Mpox, however, does cause more of like a pustule blister type lesion, whereas shingles actually manifests itself more as like a rash on skin as well. Now, I know that the claim mentioned a link between shingles and Mpox, but it also did mention that as being a side effect of COVID-19. But there is no scientific link either between Mpox and COVID. In fact, we already know so much about the Mpox virus. It's been around for decades. It was first detected back in the Democratic Republic of the Congo back in the 1970s. So we have a lot of information about Mpox already and how to control it well before the COVID health crisis began. Also, lastly, Yinka, we have been seeing fact-checking by news agencies and scientists around claims linked like this for years. For example, this fact-check here by news agency Reuters is from 2022. So we've been seeing claims like this circulate all across the internet for years. So what we have here is very much of a rehashing of those old false claims there in order to stoke up fear and spread misinformation.
And Vedika, there's also been an upswing of online homophobia as well that's being linked to these false Mpox theories. Tell us more about that.
Yes, that is correct. Some social media users have dismissed the risk of contracting Mpox, saying that it's only transmissible between gay men in specific. Now, this has led to a surge of homophobic and even in some places transphobic content as well. Some like this one, for example, these are just a couple of the examples that I found lurking on X. This one, for example, has actually created a link between not just Mpox and gay men, but also a link with paedophilia. So that is extremely disturbing as well. And although Mpox can be transmitted through sexual contact, there is no link, in fact, to sexual orientation whatsoever. Now, according to the WHO, there is a multitude of ways to contract Mpox. We have close contact, including skin-to-skin and sexual contact. There's also mouth-to-mouth. There's even face-to-face, which is talking or breathing near someone. But you can also contract Mpox from contaminated objects, such as clothing or linen, according to the WHO. So Mpox can, for example, be transmitted from a mother caring for her sick child, or even just between a heterosexual couple. It has nothing to do with sexual orientation at all. So what we can do here is mark these claims as false.